Hi, I'm Tracer Foster. Welcome back to the Home Healthcare Administrator Training Program, Module number 2. In this section, we're diving into one of the most critical aspects of running a successful home healthcare agency, regulatory compliance and legal considerations. As an administrator, it is your responsibility to ensure that your agency and its staff operates within the legal framework set forth by federal, state, and local authorities. Compliance isn't just about avoiding penalties, it's about protecting your patients, your employees, and your business. We're going to cover key regulations, licensing and accreditation requirements, patient rights, and risk management strategies to help you navigate the complex legal landscape of home healthcare. So let's get started. So the home health care industry is governed by a mix of federal and state regulations that vary depending on the type of agency you operate. Understanding these distinctions is essential for staying compliant with avoiding legal issues. Number one, private pay agencies provide non-medical services such as hands-on personal care, like bathing, dressing, and cooking, companionship, and light housekeeping. Most states regulate these agencies by laws at the state level with requirements that may include agency licensing, background checks for your caregivers, and business insurance coverage. Because these agencies don't bill Medicare or Medicaid, they have fewer federal regulations, but still must follow employment laws, state licensing laws, and patient rights protections. Number two, Medicare certified agencies must comply with strict federal guidelines set forth by the Centers for Medicare and Medicaid Services, or CMS. These agencies provide skilled nursing, therapies, and medical social work services, and they must meet conditions of participations, or the COPs, to receive Medicare reimbursements. This includes proper documentation, staff credentialing, and adherence to care quality standards. Number three, Medicare certified agencies must follow both federal and state regulations, as Medicaid is a joint federal and state program. Each state has different requirements for reimbursement, eligibility, and care standards. Medicaid agencies must ensure compliance with state health department regulations, along with Medicaid billing policies. Number four, HIPAA compliance. Regardless of whether your agency is private pay, Medicare certified, or Medicaid certified, HIPAA, which is the Health Insurance Portability and Accountability Act of 1996, applies to all home health care providers. HIPAA regulations protect patient health information and set standards for electronic medical records. Violating HIPAA can result in hefty fines and damage your agency's reputation, so ensuring that proper staff training and enhanced data security is critical. So now that we've covered the major regulatory frameworks, let's move on to licensing and accreditation. Proper licensing and accreditation ensure that your type of agency meets industry standards and builds trust with clients and referral partners alike. Let's break down the major accrediting bodies and what they require. These accrediting bodies charge a fee to become accredited. One, CMS, or the Centers for Medicare and Medicaid Services. CMS sets the national standards for Medicare and Medicaid certified home health agencies, and they must comply with the conditions of participation and undergo periodic audits to maintain that certification. Two, the Joint Commission. The Joint Commission is a leading accrediting body for healthcare organizations, including home health agencies. Accreditation by the Joint Commission demonstrates a commitment to high quality care and excellence, including patient safety, and it can help with securing contracts and referrals. Number three, CHAP, or the Community Health Accreditation Partner. CHAP is another respected accrediting organization that ensures agency meets high standards for home health care services. Many Medicare and Medicaid programs recognize CHAP accreditation as a mark of quality. Number four, ACHC, or Accreditation Commission for Healthcare. ACHC provides accreditation for home health, hospice, and private duty agencies. Like CHAP, the Joint Commission, ACHC accreditation helps agencies establish credibility and ensure compliance with industry best practices. Please note that it is not mandatory for non-medical home care agencies to become accredited unless required by your state. However, some of these organizations offer accreditation for private duty home care agencies. Obtaining accreditation is not just about meeting legal requirements, it's a way to position your agency as a leader in quality home health care by implementing best practices. Now, let's talk about a key aspect of compliance, patient rights, and advocacy. Home healthcare agencies have a duty to protect patient rights and advocate for the well-being of their clients. As an administrator, you must ensure that your staff understands and upholds all of these rights. Number one, clients' right to respect and dignity. Patients must be treated with kindness, respect, and cultural sensitivity regardless of their background or beliefs. Number 2, right to privacy and confidentiality. HIPAA requires patient information be kept secure and shared only with authorized individuals. Number 3, the right to informed consent. Patients have the right to be fully informed about their care plan and make decisions about their treatment. Number 5, right to refuse treatment. Patients can decline care or services, and their decisions must be respected unless they pose a serious risk to themselves or to others. Finally, the right to file complaints. Agencies must have a clear process for addressing patient complaints and resolving issues promptly. Ensuring that your staff is trained in patient rights is not just about legal compliance, it's about providing compassionate, ethical care. Next, risk management is a critical component of home healthcare administration. Without proper safeguards, agencies can face lawsuits, fines, and reputational damage. Here are some key strategies to minimize legal risk. First, preventing fraud and abuse. Billing fraud, upcoding, and improper documentation can result in severe penalties. Conduct regular internal audits to ensure compliance with Medicare, Medicaid, and other insurance billing regulations. 2, reducing patient injury and safety risks. Implement strict safety protocols for falls, medication administration, infection control, and disaster preparedness. Conduct staff training, practice drills, supervisory visits, and patient home environment assessments to minimize hazards. Number 3, managing employee liability. Home health aides and nurses work in unsupervised environments, increasing the risk of errors or misconduct. Proper hiring practices, background checks, and ongoing training and supervisory visits help mitigate some of these risks. Number 4, handling legal disputes and complaints. Having a structured process for addressing complaints and legal disputes can prevent issues from escalating. Encourage open communication with patients and staff and document all incidents thoroughly. By proactively managing risks, you can protect your agency from costly legal issues and maintain a reputation for excellence. So that wraps up this module on regulatory compliance and legal considerations. We've covered federal and state regulations, licensing and accreditation, patient rights, and risk management strategies. Compliance isn't just about avoiding fines, it's about creating a culture of integrity, safety, and quality care. As the administrator, staying informed and proactive in regulatory matters will help your agency thrive. If you have found this video helpful, please like and subscribe to the channel. In the next module, Module 3, we'll dive into business operations and financial management. Thank you for your time, and I'll see you in the next video.